Part A. Extract 1. Questions 1 to 12. You hear a dietitian talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Thanks for coming in. I'm Hans Cummins, the dietitian. I understand you were referred to me to discuss some health concerns. Could you tell me a little about what's been happening?
Good morning. Yes, thank you. For about a year now, I've been feeling quite sluggish. It's not just a general tiredness, I feel like I'm moving through molasses. I've also put on a noticeable amount of weight, around 15 kilograms, which is more than I'm comfortable with. I used to be a size 12, and now none of my clothes fit. But the real concern is this constant, throbbing ache in my legs, especially at the end of the day. They feel so heavy, like I'm dragging concrete blocks, and I've noticed these purplish bulging veins behind my knees and on my calves. It's quite unsightly, and I'm worried it's getting worse. I'm also getting dizzy spells, particularly when I stand up too quickly, and my vision feels blurry sometimes, like I'm looking through a dirty window. It's all a bit overwhelming, and I don't know where to start.
I see. The GP's notes mention a family history of varicosity, and it sounds like your symptoms align with that. Have you had any similar issues before, even in a milder form?
Not really this bad. My mother had similar vein issues, so I suppose it runs in the family. Hers weren't quite so severe at my age, but they progressed over time. I've tried a few things, to manage the symptoms myself. I've been so desperate. I tried a paleo diet for a couple of months, cutting out all grains and dairy, but it just made me feel completely exhausted and irritable. I also tried intermittent fasting for a while, but it didn't seem to help the leg pain at all, and I ended up binging on junk food on my eating days. And I've been wearing these compression stockings, which my GP recommended. They help a bit with the swelling and the heaviness, but it's not a complete solution, just a temporary relief.
I understand. It's good that you've been proactive. Now, Mihira, let's talk about your current lifestyle and medical history. Are you currently on any medication?
I take medication for hypertension, losartan, 50 milligrams daily. I'm also taking supplements for my vitamin D deficiency, which was diagnosed in my last blood test. Besides the hypertension, 5 years ago I had a fall while hiking and the doctor said I tore my meniscus, so high-impact exercise like running is completely out of the question for me now. I work as an accountant, so I'm seated for most of the day, from about 9 a.m. until 5 p.m. I live alone, so preparing meals can be a hassle, which often leads me to order takeaways or grab something quick from the shop, like a ready meal.
Thank you for providing that detail. Given your sedentary lifestyle and the varicose veins, we need to focus on circulation and weight management. Mihira, I recommend you start with low-impact exercises that don't put strain on your knee. Activities like swimming or cycling are excellent choices. Start with just 30 minutes, 5 times a week.
So, what about the diet? I don't want to feel deprived again.
The goal is not to feel deprived. We'll focus on anti-inflammatory and high-fiber foods to support vascular health and manage weight. I'm suggesting a diet rich in fruits like berries and citrus, and vegetables, especially leafy greens like spinach and kale. These are packed with antioxidants. We'll include lean proteins such as grilled chicken and fish, and complex carbohydrates like quinoa and brown rice. It's crucial that we cut back on processed foods, sugary snacks, and red meat, which can contribute to inflammation. Also, please reduce your sodium intake. Hydration is key. So, Mihira, make sure you're drinking at least 2 liters of water a day to help with circulation.
That sounds like a lot to remember. I'll try my best.
Extract 2. You hear a physiotherapist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good afternoon, Mihira. I'm Wilson Brad. Please have a seat. What brings you in today?
Hi, thanks, Wilson. So, the pain has been just relentless. It's my right elbow, started about a month and a half ago. A sort of niggle, you know? But now, it's a constant deep ache. It feels like it's right in the bone. It's not just the pain, it's the weakness too. I feel like I'm dropping things all the time. My grip strength is just non-existent. And it's affecting my sleep, waking me up sometimes. The throbbing is worse at night, which is really frustrating.
I see.
My right arm. My dominant one, of course. It's affecting everything. I'm a bartender, so I'm constantly lifting and shaking things. I've had to switch to using my left hand for a lot of tasks, and it's just not the same. I've also noticed a sharp, shooting pain when extending my arm, especially when I'm pouring drinks. I was hoping it would just go away on its own, but it's only getting worse.
Have you tried any treatments so far?
Yes, a few things. Initially, I just took over-the-counter painkillers, paracetamol, and ibuprofen, which barely touched it. I've also tried applying a cold compress, which helps with the throbbing for a little while, but the effect is fleeting.
I understand, Mihira. Let's do a quick examination. Can you point to the area of the most intense pain?
It's right here on the outside of the elbow. If I push on it, it's really tender.
Okay. That's quite a strong reaction. It seems consistent with lateral epicondylitis. The repetitive strain from your job is likely a major contributing factor. We'll start with some targeted exercises and stretches to improve flexibility and strengthen the surrounding muscles. You'll need to wear a brace during work to offload the tendon. This will help reduce mechanical stress and give the tissue a chance to heal. I also recommend a course of nonsteroidal anti-inflammatory drugs, or NSAIDs, for a couple of weeks to manage the inflammation. These should help alleviate pain and improve mobility as the tendon begins to recover. We'll schedule follow-up appointments twice a week for the next month to monitor your progress. It's a gradual process, but with consistent treatment and a bit of rest, we should see significant improvement.
Okay, that sounds like a plan. So I have to take time off?
Ideally, but if you can't, the brace and consistent exercises will be crucial. Try to modify your technique at work where possible.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. You hear a nurse called Mihira talking to a colleague.
Sarah, have you seen the new online leave application form? It's supposed to streamline the process, but I found it confusing. I needed to request time off for my sister's wedding next month.
Oh, I used it last week. Mihira, the main issue is that it requires you to upload supporting documents immediately, like a flight itinerary or a formal invitation. I didn't have mine ready, so I had to save it as a draft.
Right, and that's the problem. If you don't complete it in one go, the system logs you out after 10 minutes. Then you have to start over from the beginning, which is so frustrating.
Absolutely, Mihira. Also, the section about leave type is tricky. You have to choose between personal, family event, or emergency. For a wedding, family event seems correct, but I heard it requires extra approval from the head nurse.
That's what I was afraid of. I think the immediate effect is that it actually delays approval because people submit incomplete forms or choose the wrong category, and then it gets sent back. It's created more work for everyone.
Maybe we should suggest a tutorial session during the next staff meeting.
Question 26. You hear a physician called Mihira talking to a nurse.
I've been reviewing the plan for the diabetes awareness session next week, and I noticed the flyer mentions high blood sugar, but not low blood sugar. That could be confusing.
Yes, especially since the hypertension group meets right before, and some people might turn up thinking it's about blood pressure.
Exactly, and with the wording so close, someone could easily mistake one for the other.
When we covered diet last year, a few people asked whether dizziness meant low sugar or low pressure. The answers weren't clear, and some went home more confused.
That's why this time we should highlight symptoms carefully. If people misread the flyer and attend expecting blood pressure advice, they'll leave thinking the session wasn't for them.
And worse, they might ignore the actual warning signs of diabetes because they think they've heard it already.
Right, so making the distinctions clear in both the flyers and the talk should prevent that problem.
Mihira, I'll edit the handouts to show the differences more clearly.
Question 27. You hear a physician called Mihira talking to a physiotherapist.
Hi, Michael. Thanks for coming in. I wanted to chat about Mr. Davison, the patient I referred to you last week. He's a bit of a tricky case.
No problem, Dr. Mihira. I've reviewed his file. You've noted suspected plantar fasciitis, but he's also presenting with significant knee pain.
Yes. He came in complaining primarily about his foot, a sharp pain in his heel in the mornings. I was quite sure it was a classic case. However, during the examination, he kept wincing when I asked him to straighten his leg. He's also mentioning persistent aching behind his kneecap, which seems to flare up most when he's going downstairs. That's a new development since his last visit.
Yes, that's what I found. The foot pain is there, but I think the knee is the main issue. He has some noticeable quadriceps tightness and weakness, and the patellar tracking seems off. It's consistent with a different kind of overuse injury, not the kind that affects the heel. It feels more like a mechanical problem stemming from the knee itself, rather than a ligament or tendon issue in the foot. I think addressing the knee is the priority.
That's my concern. He's focused on the foot pain, but I'm worried about the larger problem. I agree we need to start there.
My plan is to begin with strengthening exercises for his quads and some manual therapy to improve his patellar movement. Mihira, I'll address the foot secondary to the knee.
Question 28. You hear an occupational therapist called Mihira talking to a patient.
Good morning, Mr. Evans. I'm Mihira, the occupational therapist. I understand you've been having some trouble with your hands, making daily tasks difficult.
Yes, Mihira, that's right. It's the stiffness and weakness, especially in the mornings. It's hard to even hold a toothbrush or button my shirt.
I can imagine that's very frustrating. We can look at some tools to help with your grip. There are special utensils with thicker handles that are easier to hold. But what about opening jars? Is that a problem too?
Oh, absolutely. I can't get the lid off anything. My wife has to do it all for me.
That's a common challenge. For that, a jar opener would be very useful. It gives you the leverage you need. However, the most important thing right now is to help you be more independent with your personal care, like washing and dressing. So, let's focus first on getting you a long-handled sponge for your back and a button hook for your shirts.
A button hook? I've never heard of that, Mihira.
It's a clever little device that pulls buttons through the hole for you. It will make getting dressed much less of a struggle.
Question 29. You hear a nurse in charge called Mihira talking to a junior nurse.
Hi, Jacob. Can you give me a quick update on Mrs. Bennett in room 14? I just saw her chart.
Sure, Mihira. I've been with her all morning. Her main complaint is still the discomfort from the rash. She initially thought it was a simple allergy to a new soap, but it has developed into more of a blistering, weeping condition, which is what the doctor wants to focus on. She's been a little agitated about the whole thing, understandably.
I saw that note about a possible skin irritation. Was there anything about her recent trip? I remember she was away last week.
Yes, she was in the countryside. She mentioned walking through some bushes, and then a few hours later, her skin started to get red. She put some calamine lotion on it herself, which didn't help. The doctor is considering a diagnosis of contact dermatitis, possibly from a plant like poison ivy. It's a bit of a puzzle.
That's what I was thinking. So, the blistered skin isn't just a simple allergic reaction then? It's a specific kind of inflammation. That needs to be monitored closely. I'll make sure the records reflect that.
Exactly, Mihira. I've noted down the doctor's plan to use a topical corticosteroid cream and to redress the area twice a day. He's also put in an order for an oral antihistamine to help with the itchiness, but the priority is clearly managing the skin's surface inflammation. The patient herself keeps talking about her stress levels affecting her skin, but it seems more directly related to her exposure.
Perfect. Let's make sure the next shift understands that it's not a stress rash.
Question 30. You hear a community nurse called Mihira talking to a GP.
I wanted to update you about the home visit yesterday. The patient reported feeling dizzy in the morning, but by the time I arrived, they only complained of being lightheaded after standing.
That sounds more like low pressure than anything else. Did they mention headaches or blurred vision?
No headaches, but they did say their legs felt heavy. I wasn't sure if it was just tiredness or something linked to the dizziness.
I see. Sometimes people mix up heavy legs with weakness, which can point to something else entirely. Did they drink enough water yesterday?
That's the thing. They said they hadn't had much to drink, but they had eaten a heavy lunch just before the dizzy spell.
So the symptoms could just be from dehydration or food intake. Still, it's worth keeping a close eye.
I agree. In my view, a follow-up visit is more important than sending them in straight away. That way we can check again without alarming them unnecessarily.
That sounds reasonable, as long as the family knows when to call if things change.
Part C. Extract 1. You hear a nephrologist, Dr. Mihira, and an interviewer discussing a topic of growing concern: the link between lifestyle and kidney health.
Welcome, Dr. Mihira. Thank you for joining us. We're here to discuss a topic of growing concern, the link between lifestyle and kidney health. To start, how would you define a healthy kidney in simple terms?
A healthy kidney is one that efficiently filters waste and excess fluid from the blood, maintaining a delicate balance of electrolytes and blood pressure. It functions as the body's primary filtration system. It's a complex organ, and its health is vital for overall bodily function. The filtration process is constant, and its efficiency is what we look for when we assess kidney function.
That makes sense, Dr. Mihira. What are the primary culprits behind kidney-related problems that you see in your practice today?
The two most significant contributors are chronic conditions like hypertension and diabetes. These diseases, when left unmanaged, cause gradual, long-term damage to the kidney's delicate blood vessels and filtering units. These conditions are silent destroyers, often progressing without overt symptoms until significant damage has occurred. In essence, it's the sustained high pressure or elevated glucose levels that wear out the kidney's intricate machinery over time.
So, these chronic diseases are the main drivers. Dr. Mihira, what recommendations do you have for someone trying to proactively maintain their kidney health?
The cornerstone is a balanced approach. It begins with managing chronic illnesses effectively through regular checkups and adherence to prescribed treatments. But it also extends to a holistic lifestyle. This includes a diet low in processed foods and sodium, staying adequately hydrated with water, and engaging in regular physical activity. Monitoring blood pressure and blood sugar is also crucial, especially if you have a family history of kidney issues.
Let's focus on those lifestyle factors. Beyond diet and exercise, are there other lifestyle habits that directly impact kidney health, Dr. Mihira?
Absolutely. Smoking and excessive alcohol consumption are major culprits. Smoking restricts blood flow to the kidneys, and heavy alcohol use puts an immense strain on the kidney's ability to filter toxins. Furthermore, the indiscriminate use of over-the-counter pain relievers, particularly NSAIDs like ibuprofen, can be very damaging to kidneys, especially with long-term use. Even simple things like a lack of sleep and high stress levels can indirectly affect kidney function by impacting blood pressure.
That's concerning. We hear a lot about lifestyle diseases becoming hereditary. Dr. Mihira, do these lifestyle-driven kidney problems transfer to the next generation?
While the genetic predisposition for conditions like diabetes or hypertension can be inherited, the direct kidney damage from lifestyle choices is not. A parent's kidney disease itself is not passed down. However, unhealthy lifestyle habits, dietary patterns, lack of exercise, smoking, are often learned and passed on within families, which can then predispose the next generation to developing the same chronic conditions that lead to kidney issues. It's a transmission of risk factors, not the disease itself.
Finally, Dr. Mihira, just how serious are these lifestyle factors in the broader picture of kidney health?
Their impact is profound. In a significant number of cases, kidney disease is now preventable or manageable simply by addressing these lifestyle factors. We're seeing a global rise in chronic kidney disease, much of which is directly correlated with modern lifestyles. It's a global public health crisis, and while genetic factors play a part, the modifiable lifestyle aspects are what we, as a society, can actually change. Ignoring them is to ignore the root cause of much of the disease burden we face today.
Extract 2. Questions 37 to 42. You hear a physician talking about the health of our healthcare professionals.
Good morning, everyone. It's a privilege to be here today at the Mihira Research Institute to discuss a topic of paramount importance, the health of our healthcare professionals. We at Mihira Care have dedicated significant resources to understanding and addressing this critical issue, recognizing that the well-being of those who care for others is foundational to a robust healthcare system. The question, are healthcare workers truly healthy, often yields a counterintuitive answer. While they possess an extensive knowledge of health and disease, the very nature of their profession exposes them to a unique array of physical and psychological stressors. The demands are relentless, from extended shifts and emotional burnout to direct exposure to infectious agents and the physical strain of patient handling. This paradox suggests a gap between knowledge and practice, where personal health is often deprioritized in the face of professional obligations. Our work at Mihira Care has repeatedly shown that the health metrics of this group often lag behind the general population, particularly in areas related to mental and chronic physical health. The common health issues are not merely anecdotal. They are substantiated by a growing body of evidence. Musculoskeletal disorders, for instance, are rampant, often stemming from repetitive tasks and the physical demands of lifting and moving patients. We also see a high prevalence of mental health conditions, including anxiety, depression, and post-traumatic stress disorder, which are direct consequences of vicarious trauma and high-stress environments. Furthermore, healthcare workers face an elevated risk of infectious diseases and are prone to conditions like hypertension and cardiovascular disease, which are often exacerbated by poor dietary habits, lack of sleep, and chronic stress. Through our initiatives at Mihira Care, we have documented these trends meticulously to inform targeted interventions. Tackling these issues requires a multi-pronged approach that goes beyond basic wellness programs. It demands systemic changes. We must advocate for and implement policies that ensure adequate staffing levels, provide mental health support services that are easily accessible and destigmatized, and invest in ergonomic equipment and training to mitigate physical injury. Mihira Care, in collaboration with hospital administrators, is developing integrated care models that treat the health of the healthcare worker as an intrinsic part of institutional responsibility, not a peripheral concern. This includes promoting a culture of self-care and encouraging professionals to seek help without fear of professional repercussions. Analyzing the health of healthcare workers requires a holistic and data-driven methodology. It's not enough to simply look at sick leave records. We need to employ a combination of quantitative and qualitative research methods, including anonymized surveys, biometric screenings, and longitudinal studies that track health outcomes over time. At the Mihira Research Institute, we utilize sophisticated data analytics to identify patterns and risk factors, allowing us to move from reactive treatment to proactive prevention. This analytical rigor is what underpins the effectiveness of our programs at Mihira Care, enabling us to pinpoint specific stressors within a given department or specialty and tailor our solutions accordingly. Maintaining the health of our healthcare workforce is an ongoing commitment, not a one-time initiative. It involves fostering a supportive work environment where communication is open and concerns are addressed promptly. It means providing regular, mandatory training on topics such as stress management, conflict resolution, and proper ergonomic techniques. We must also encourage a healthy work-life balance, recognizing that a well-rested and supported professional is a more effective caregiver. Mihira Care provides resources and workshops aimed at building resilience and promoting a sustainable career in healthcare. Finally, early detection is key to preventing minor issues from escalating into chronic conditions. This involves implementing regular health screenings that are tailored to the specific risks faced by healthcare workers. These screenings should include mental health assessments, not just physical checkups. It is crucial to create a non-judgmental atmosphere where professionals feel comfortable disclosing personal health struggles without fear. At the Mihira Research Institute, our research is focused on developing predictive models that can identify individuals at high risk for burnout or illness before symptoms become severe, allowing for timely intervention and support. This proactive stance is central to the mission of Mihira Care and our commitment to nurturing those who dedicate their lives to helping others.